Hi everyone, welcome to Research MD. This is Dr. Pramil, and I work as a Chief Medical Officer in the United States, also an Assistant Professor of Medicine, one of the large medical schools in the United States. Today our topic is about the flavonoids and how does it affect or improve our health. Okay, flavonoids are naturally occurring products. They're polyphenol compounds, have like a lot of benefits. So first of all, where do you find flavonols? Flavonols, if you look at it, a lot of vegetables, fruits, vegetable. Anytime you see there's a lot of color, this pigmentation, those have a lot of flavonoids. You can have it in the whole grain. It's like another big source of like flavonoids. And then you have like a coffee, berries, and onion, black tea, garlic. There are many, many other things like cabbage, broccoli is another big source of flavonoids. And recent studies have shown that flavonoid have a lot of impact on the gut bacteria. If you look at it in today's world, everybody is talking about how to improve your gut function and overall health, right? That's why, if you look at it recently, the last 5 years, the use of probiotics in the United States has gone up, I don't know, 100 times. A lot of people are taking probiotics. So let's look at the relationship flavonoids and the gut bacteria. When you look at the gut bacteria, there is you got the bad boys and the good guys, right? One of the bad people is the E. coli and, Staph aureus. Those are the things you don't want that to go out of hands. That's when you have this infection in the colon, especially in the elderly. But what are the good, when you look at the good bacteria, the lactobacillus and bifidobacterium, those are the main two species, has an excellent benefit in our gut health, right? So what flavonoids is, when you take a flavonoids, the most of the effect is like it stays in your gut for a long time. When you stay in the gut, and it promote the good bacterial growth. And when I talk about good bacteria, especially lactobacillus, right? And then this, a lot of people, I think, fail to understand our gut is related to our brain also. A lot of things, what happens in the abdomen kind of affect our brain. And when you look at the flavonoids, it crosses the blood-brain barriers. A lot of, some of the products cannot kind of go through the blood-brain barrier and enter into the brain. But flavonoid got the special ability, so it can, it can cross the blood-brain barrier and it just hit the brain. So how does it help? Let's say if you have Alzheimer's, dementia, or any kind of cognitive problem and neurodegenerative disorders, adding flavonoids to your diet will be extremely beneficial, because there's not many things, if you look at it, does not cross blood-brain barrier. Okay, so again, this naturally occurring polyphenol compounds. We talk about all this. The fruits, vegetable, where there's a lot of color, always have. Because of the pigmentation, they have like a lot of flavonoids. Now, again, we talk about the gut. So how does it affect the other places? Like, let's say it's a big antioxidant. When you talk about this increased free radical formation, then the antioxidant properties have big benefit and all that. It's also got like hepatoprotective, right? A lot of us kind of drink, or like fatty liver, like many of this, when you go to the doctor, you see what they say. Oh, I got a lot of patients come to me and said like, oh, I got fatty liver. Should I be worried and all that? So so you got like hepatoprotective effect, because it decreases fibrosis in the liver. It decreases the toxin accumulation in the liver, okay? And you got again, with geroprotective and geriatric patient, we talk about what do the worst, problem a geriatric patient have is the loss of memory, right? If you ask everyone, they said even if you don't want to live in a world your memory is gone, but this is a very good, taking flavonoids, will definitely help you into that. Again, anti-diabetes, again, a big thing. It increase the insulin action and decrease the insulin resistance and increase the glucose utilization. These are, this is a recent study, just I think they gave flavonoid supplement, and there's a meta-analysis, okay, and they looked at, I think it was a 25 randomized control study, and it shown that it decreased insulin resistance and a better glucose control. And it's also a very big role in the obesity patient also. When you look at the cancer properties, anytime we talk about antioxidant, it can decrease the cancer, right? It decreases cell proliferation cancer, decrease apogenesis, and decrease the cell cycle. That means, when you talk about cancer, what happens? Cells multiply, sort of randomly so fast. It also decreases the cell cycle. And let's look at the cardio. When you look at the cardioprotective effect of flavonoids, or decrease endothelial function, and then could decrease the cholesterol, and it also causes, decrease the blood pressure, the hypertension. So the main thing, again, cholesterol, decrease hypertension, decrease high blood pressure. Okay, now antimicrobial, we talk about decreased pathogens, especially in the gut. And, a lot of people, in the beginning of the talk, I said about how people are taking probiotics to improve the gut health. If you take flavonoids with the probiotic, you get that double effect, okay? So check, when you take a probiotic, always consider flavonoids. It's called, again, anti-inflammatory, the leukocyte immobilization, decreased complement activation, and all these pro-inflammatory markers usually gone down. It also, when we talk about, the gut, right? The gut and the brain is kind of related, and then this thing from the gut can cross the blood-brain barrier. And when you talk about the neuroprotective effect, I think it's, what are the things, how does it do? Once it hit the brain, it decreases the amyloid deposition and decrease MA, decrease monoamino oxidase, which does a lot of damage to the brain. So overall, this flavonoids, it's available, in naturally, and all these fruits we talk about, whole grains is like one of them. We talk about the coffees, berries, and then black tea, onion, garlic, cauliflower, broccoli, cabbage, and all of these people, all of this, all of these fruits and food particles have like a lot of flavonoids, and you can take. Now, if you cannot find it, you can also take like flavonoid supplement, which you can kind of go into vitamin store and see like contain the flavonoid. I think it's very good. Studies have shown that, a lot of studies like randomized control studies. One thing I said about the insulin, the glucose control, is a randomized control of the meta-analysis shown all these benefits. So thank you so much for watching. God bless.